Last week was a busy week for European health policy. In addition to an agreement being reached on funding for the EU4Health program, the European Commission has unveiled its strategy for a new European health union. To begin, the European Parliament and the Council have finally agreed on the overall framework for the next long-term budget of the EU, aka the MFF. However, on Monday, the agreement was blocked by Hungary and Poland, whose governments oppose the rule of law mechanism that has been attached to the EU funds. As the agreement requires unanimity, EU leaders will meet later this week to see if there's any way to overcome the impasse. Out of a budget of over 1 trillion euros, 5.1 billion will go to the EU4Health program. This sum is the result of intense interinstitutional negotiations between the Commission and the European Parliament, who envisioned a budget of 9.4 billion, and the Council, who wanted to cap it at 1.7. Now that both sides have met somewhere in the middle, MEPs in the Council will negotiate the exact terms of all spending programs, which we can anticipate by the end of this year. It's no coincidence that the day after the budget was announced, the Commission unveiled the new European Health Union. This strategy is accompanied by 3 legislative proposals. The first looks to upgrade the current non-binding directive on cross-border health threats to a regulation, which means member states will be required to implement it into legislation. Everything within this proposal looks to strengthen the capacity of the EU to respond to future health challenges. This will be made possible by the next 2 proposals, which look to expand the role of 2 key agencies: the European Centre for Disease Control and Prevention, the ECDC, and the European Medicines Agency, the EMA. In sum, these proposals look to grant more centralized authority to these agencies to enable coordination of an EU response to future health threats and implementation of policy. This announcement is a direct result of the COVID-19 crisis, which has exposed massive gaps in EU power related to health matters. And as we've learned in 2020, health is a precondition for functioning societies and economies, making it a priority at the highest level like never before. These proposals will now be negotiated by the Council and the European Parliament. As they build on existing legislation and practices, the Commission anticipates swift adoption. And if you're worried about health not being a competence of the EU, the Commission offers its assurance that all is possible under the current treaties. In the words of the Commission, the strength of this new health union will only be as strong as the commitment of its member states.